My name is Dr. Robert Chen, and I've been a burn surgeon at the University of Texas Medical Branch in Galveston for 19 years. In that time, I've treated over 3,000 burn patients. I understand the devastating mathematics of burn injuries, the percentages of body surface area affected, the depth of tissue destruction, the precise point where survival becomes impossible. Anything above 70% total body surface area with third-degree burns is generally fatal. At 80%, survival is extraordinary. At 85%, survival is medically impossible. But what I witnessed over 6 days in August 2023 taught me that the human body is capable of things our textbooks say cannot happen, that sometimes human tissue can regenerate at impossible speeds, and that sometimes a doctor's duty to protect their patient must come before their duty to advance medical science. The case that changed everything arrived on August 14, 2023, at 11:47 p.m. I was on call when my pager went off. Trauma alert. Incoming burn victim. Helicopter transport. ETA, 7 minutes. I met the helicopter on the rooftop. The flight paramedics report was grim. Male, mid-30s, trapped in chemical fire at a refinery. Approximately 85% total body surface area burns. Mostly third degree. He's intubated, sedated, barely maintaining blood pressure. They wheeled him into our trauma bay. His name was Michael Torres. 34 years old, chemical engineer. What I saw made my stomach drop. His entire torso was charred. His arms were burned to the bone in places. His legs showed deep, third-degree burns with visible muscle tissue. His face was blistered beyond recognition. The only areas spared were small patches on his upper back and parts of his scalp. Get him to Trauma 1. Start the protocol. Over the next 2 hours, my team assessed his burns. Using the rule of nines, we calculated approximately 85% of his total body surface area. The vast majority were third-degree, full-thickness burns, destroying not just skin, but deeper dermis, leaving exposed fat, muscle, and bone. I called his wife, Maria, who arrived within 30 minutes. "Mrs. Torres," I said gently, "your husband has sustained very severe burns covering most of his body. I need you to understand the situation. Is he going to die?" I've never lied to a family. His injuries are catastrophic. Burns covering more than 80% of the body have a survival rate close to 0. Even if he survives, he'll face months of surgeries, skin grafts, infections. The road ahead will be incredibly difficult. But there's a chance? There's always a chance. We'll do everything possible, but be prepared for the worst. She nodded through tears. Do everything you can. We have 2 kids. They need their father. We moved Michael to our burn ICU. Over the next hours, we continued aggressive treatment, monitored for organ failure, began planning surgical interventions. By dawn on August 15th, Michael Torres was still alive. Against all odds, he'd survived the critical first night. I examined his burns closely, documenting everything. Third-degree burns, with some fourth-degree areas, on his arms and upper thighs. Charred black in some places, waxy white in others. No sensation, nerve endings destroyed. I took photographs to track healing progress and plan grafting. I prepared Maria for what was coming. If he survives, he'll need multiple surgeries. We'll remove dead tissue, then perform skin grafts. Given the extent of injuries, recovery will take months, possibly years. Will he look the same? No. Burns of this severity leave significant scarring. That evening, August 15th, I performed the first debridement surgery, 6 hours of carefully removing dead tissue, exposing raw flesh beneath. I updated Maria afterward. The surgery went well. Tomorrow we'll begin planning the grafting procedures. That night I went home exhausted. I'd been a burn surgeon long enough to know that, despite perfect care, patients don't always make it. The body can only endure so much. I expected Michael Torres to die within the week. On the morning of August 16th, 36 hours after his admission, I went to check on Michael during morning rounds. My burn unit fellow, Dr. Sarah Martinez, was already at his bedside, staring at his chart with a confused expression. "Robert, come look at this," she said. I approached the bed, and what I saw made me stop in my tracks. The burns looked different, not worse, different. The areas I'd debrided yesterday, which should have been raw and bleeding, looked cleaner, healthier, as if healing had already begun. "That's not possible," I said. "It's been less than 24 hours since debridement." "I know, but look at his left arm. Where we removed the eschar yesterday, the tissue is granulating. It's forming new tissue." I examined his arm closely. She was right. Granulation tissue, the pink bumpy tissue that forms during wound healing, was already visible. This was a process that typically took 3 to 4 days to begin, not 36 hours. Could we have misjudged the burn depth? I suggested. Maybe some areas were shallower than we thought? I was in the OR with you. I saw the same thing you did. These were full-thickness burns, down to fat and muscle in places. I checked his other burn sites. The same phenomenon. Early granulation tissue that looked healthier than it had any right to look. Keep monitoring him closely, I said. Document everything. Increase the frequency of wound assessments. I want photos every 6 hours. That evening, I reviewed the photographic documentation. The progression was undeniable. In the span of 1 day, Michael's wounds had progressed through healing stages that should have taken a week. On August 17th, day 3, Michael's wounds showed even more impossible progress. New epithelial tissue, the thin layer of cells that forms new skin, was visible at the edges of his burns. This tissue was pink, healthy, growing inward from the few unburned areas. "Robert, I don't understand what I'm seeing," Sarah said during our morning assessment. "His burns are healing at an accelerated rate. This level of epithelialization doesn't happen this fast. It shouldn't be possible." "I know. Should we document this? Present it to the department? This could be—" "Not yet," I said quickly. Too quickly. Sarah looked at me with surprise. "Let's make sure we're not missing something first. There could be factors we haven't considered." But I knew there weren't any factors we'd missed. I'd practiced burn surgery for 19 years. I knew the timeline of burn healing. What was happening to Michael Torres violated every principle of wound healing I'd ever learned. By August 18th, day 4, Michael Torres's burns had progressed to a healing stage that should have taken 2 to 3 weeks. The granulation tissue was well established. Epithelial tissue was advancing rapidly across his wounds. Most incredibly, the deep, third-degree burns on his torso were showing signs of healing from within. New tissue forming in the deeper layers, pushing upward. I began spending more time at Michael's bedside, observing, documenting, privately, trying to understand what I was witnessing. His vital signs were strong. His organs were functioning normally. There were no signs of infection, despite the massive open wounds. His body was healing itself at a rate I'd never seen. Healing that shouldn't be possible with burns of this severity. On August 19th, day 5, I made a decision that would violate every protocol I'd been trained to follow. I stopped documenting the full extent of his healing in the official medical record. In my official notes, I wrote, "Patient showing unexpected improvement. Wounds healing adequately. Continue current treatment plan." In my private journal, a notebook I kept locked in my office desk, I wrote the truth. Patient showing impossible regeneration. Third-degree burns healing as if they were second-degree. New skin tissue forming at rate approximately 10x normal. No medical explanation. No precedent in literature. Sarah pulled me aside that afternoon. "Robert, we need to talk about the Torres case. His healing is extraordinary. We should be documenting this, publishing this. This could change our understanding of burn treatment." "I'm aware of how unusual this is," I said carefully, "but I need you to trust me on something. For now, we keep the details of his healing progress between us. Standard documentation in the chart, nothing more." "Why? This is incredible. This is a human being, Sarah. Not a case study, not a research subject. A man with a wife and children who has been through unimaginable trauma. If word gets out about his unusual healing, what do you think happens? Medical researchers will descend on him. He'll become a specimen, not a patient. His privacy will be destroyed. His life will become a circus." She was quiet for a moment. "You're protecting him." "I'm doing what's best for my patient. That's my first duty. Always." Sarah nodded slowly. "Okay, I'll follow your lead. But Robert, we need to understand what's happening. If his body can do this, maybe we can learn from it. Maybe we can help other burn victims." "I know, but first he needs to recover. Then, if he chooses to participate in research, that's his decision, not ours." On the evening of August 19th, I sat down with Maria Torres. Michael was still sedated, but his condition had improved so dramatically that I was planning to begin waking him the next day. "Mrs. Torres, your husband is doing remarkably well. Much better than I expected." Hope flooded her face. "He's going to survive?" "I believe so. His wounds are healing faster than typical burn injuries. It's extraordinary, actually. Thank God. When can I see him properly? When can he wake up?" "Tomorrow, we'll begin reducing his sedation. He should be conscious within 24 hours. But I need to discuss something with you. Your husband's healing has been unusual, faster than normal. If this becomes known in the medical community, there will be significant interest in studying his case. I want to protect his privacy and give him control over how much information is shared. Do you understand? She nodded. You think he's healing too fast? Is that dangerous? No, it's not dangerous. It's just unusual. And in medicine, unusual cases attract attention. Sometimes more attention than is helpful for the patient. We just want him to come home, doctor. We don't need attention. Good. Then we're on the same page. On August 20th, day 6, I began the process of waking Michael Torres from his medically induced coma. As his sedation levels decreased, he started responding to stimuli. His eyes fluttered open. He began breathing over the ventilator. By that evening, we extubated him, removing the breathing tube. He took his first conscious breath in nearly a week. His first words were, "Maria." "She's here," I said. "We're bringing her in now." I allowed Maria to enter his room. She approached his bed slowly, taking in his appearance. His face was still swollen, still showed signs of the burns, but it was recognizable. The skin that had been charred and blistered 6 days ago was now pink and healing, new tissue forming where destroyed skin had been. She took his hand, one of the few areas that had been relatively spared, and wept. That night, I performed a complete assessment of Michael's burns. I took new photographs to compare with the admission photos from 6 days earlier. The difference was immense. On admission, 85% TBSA burns, primarily 3rd degree, with some 4th degree areas. Charred, destroyed tissue, exposed muscle and fat. Day 6, 85% TBSA, healing burns, now appearing closer to late 2nd degree. Pink granulation tissue, advancing epithelialization. New skin forming across all affected areas. In 6 days, Michael Torres had progressed through healing stages that should have taken 6 to 8 weeks. His body had regenerated tissue at a rate approximately 10 times faster than normal human healing. I sat in my office that night, staring at the photographs, trying to formulate a hypothesis. Any hypothesis. Accelerated cellular regeneration. But caused by what? Enhanced growth factors? Some unknown genetic factor? A mutation that enhanced healing capacity? I ran additional blood tests, without telling anyone what I was looking for. I tested for growth hormone levels, checked inflammatory markers, looked for anything unusual in his cellular biology. Everything was normal, completely normal. There was no biological marker to explain what his body was doing. On August 21st, day 7, I consulted with Dr. James Park, our genetics specialist. Hypothetically, if a patient showed dramatically accelerated wound healing, say 10 times normal, what would you look for? Growth factors would be first. IGF-1, TGF-beta. If those were elevated, that could explain it. And if they're normal, then cellular level, maybe enhanced stem cell activity, or genetic factors we haven't identified. There's still much we don't understand about tissue regeneration. Could it be entirely unknown? The human body is remarkable. We discover new mechanisms all the time. But accelerated healing at that rate? That would be extraordinary. Worth studying extensively. He gave me a knowing look. Though I suspect you have a real patient in mind. If you did, and they wanted privacy, I'd respect that. But, Robert, if you're seeing something truly extraordinary, you have an obligation to medicine. Not to exploit the patient, but to understand. That knowledge could help others. By August 22nd, day 8, Michael Torres's burns were healing so rapidly that I had to revise my treatment plan entirely. The extensive skin grafting procedures I'd anticipated were no longer necessary. His body was generating new skin on its own, from the inside out, across the burn areas. "I don't need grafts?" Michael asked when I explained this to him. His voice was still hoarse from the breathing tube, but his mind was clear. "No, your body is healing on its own. Remarkably well, actually. Is that normal?" I chose my words carefully. "It's faster than typical, but everyone heals at different rates. Your body seems particularly good at regenerating tissue." He accepted this explanation, for now. Over the next week, I watched Michael's impossible healing continue. By day 14, his burns had healed to a point that would typically take 3 months. New skin covered areas that had been charred to the bone 2 weeks earlier. And here was the most impossible part. There was minimal scarring. Burn scars are inevitable with 3rd degree burns. The tissue never regenerates perfectly, but Michael's new skin was smooth, supple, almost normal in appearance. It was as if his body was completely regenerating tissue, not just patching over damage with scar tissue. On August 28th, 2 weeks after his admission, Michael Torres walked out of the hospital with his wife and children. He wore long sleeves and pants to cover the remaining evidence of his burns, but to anyone who saw him, he looked like a man recovering from a bad sunburn, not someone who had survived catastrophic 3rd degree burns covering 85% of his body. The nursing staff called it a miracle. The chaplain attributed it to divine intervention. My colleagues whispered about how lucky he was, how rare it was to see such a positive outcome. No one, except Sarah and I, knew the full truth. Before he left, I pulled Michael aside privately. "Mr. Torres, I need to talk to you about your recovery. It's been extraordinary, faster and more complete than anything I've seen in 19 years of burn surgery." "I'm grateful, Dr. Chen. You saved my life. Your body saved your life. I just provided support. But Michael, your healing has been so unusual that it would be of great interest to the medical research community. I've kept the details private so far, but you have a decision to make. Your body appears capable of tissue regeneration far beyond normal human healing. That knowledge could potentially help other burn victims, but it would mean invasive study, loss of privacy, and becoming a medical subject rather than just a person." He was quiet for a long moment. "What would you do if you were me?" "I'd probably choose privacy, but I'm not you, and I'm not someone who just survived what you survived. I have a wife and 2 kids, Dr. Chen. I work in a refinery. I just want to go back to my normal life. I don't want to be a medical curiosity." "Then that's your decision, and I'll respect it. No one will know the full extent of your healing from me." He shook my hand. "Thank you for everything." 2 months later, I received a call from the Burn Foundation requesting Michael's case details for their registry of severe burn survivors. I provided basic information: age, burn extent, survival outcome. Nothing about the impossible speed of his healing. Nothing about the lack of scarring. Nothing that would attract special attention. I also submitted a brief case report to a burn journal, carefully worded: "Patient with extensive TBSA burns showed unexpectedly positive outcome. Demonstrates importance of aggressive early intervention and supportive care." No mention of the impossible regeneration. No discussion of the biological miracle I'd witnessed. Sarah pulled me aside one day in the burn unit. "You buried it, didn't you?" "The Torres case. I protected my patient's privacy. You also buried potentially groundbreaking medical information." "Yes, I did. Do you think you made the right choice?" I thought about this carefully. I think I made the only choice I could live with. Michael Torres didn't ask to become a medical mystery. He just wanted to survive and go home to his family. I helped him do that. And if this happens again, if we see another patient with this ability, then that patient deserves the same protection, the same choice. 3 months after Michael's discharge, I visited him at his home in Texas City, about an hour from Galveston. He answered the door in a t-shirt and jeans. His arms, which had been burned to exposed muscle 3 months earlier, showed only faint discoloration where the worst burns had been. "Dr. Chen, come in. Maria, Dr. Chen is here." Maria emerged from the kitchen, along with their 2 children, a boy about 8 and a girl about 5. The kids were shy but curious. "How are you feeling?" I asked. "Good. Really good, actually. I went back to work last week. Light duty, but still. They couldn't believe I was ready so soon." "And the burns? Any problems with the healed areas?" "Some tightness here and there, but nothing bad." "Dr. Chen, I wanted to ask you, is it normal that the scars are fading? I mean, I expected to be scarred for life, but they're getting lighter every week." They were. I could see it. The areas that should have been thick, permanent scars were fading to match his normal skin tone. His body was continuing to heal, regenerate, perfect itself, even months after the injury. "Some scars fade over time," I said, which was true. "But yours seem to be healing particularly well. Your body has a remarkable capacity for regeneration. Is that genetic? Could my kids have it too?" I hadn't considered that. If Michael's healing ability was genetic, his children might carry the same trait, which meant, if they ever suffered burns. "I don't know," I admitted. "There's still a lot we don't understand about tissue healing, but it's possible." After I left, I sat in my car for a long time, thinking about the implications. If Michael's healing ability was genetic, inheritable, there might be others out there with the same capacity, people whose bodies could regenerate tissue at extraordinary rates. And if that was true, if this wasn't unique to Michael Torres, then I'd made the right choice in keeping it private. Because if the medical establishment discovered a population of people with superhuman healing abilities, those people would never have normal lives again. They'd become research subjects, lab specimens, living experiments. Their autonomy would be secondary to the pursuit of medical knowledge. I thought about my own parents, who had immigrated from Taiwan in the 1970s. They'd raised me with a deep respect for both modern science and traditional values. My father, a biologist, had taught me to question and explore. My mother, a nurse, had taught me that caring for patients meant seeing them as whole people, not just bodies to be fixed. As a burn surgeon, I'd always focused on the science, understanding tissue damage, mastering surgical techniques, optimizing healing. But Michael Torres had reminded me that medicine is ultimately about people, about protecting those who are vulnerable, about using knowledge wisely, not just pursuing it relentlessly. 6 months after Michael's discharge, I received another burn patient with extensive injuries, a 19-year-old girl burned in a house fire. She had 60% TBSA burns, mostly third degree. I approached her case with the same aggressive treatment, but her healing followed a normal trajectory. Weeks of painful debridement, multiple grafts, months of recovery, extensive scarring. Normal. Tragic, but normal. Michael Torres wasn't reproducible. His healing wasn't something I could replicate. It was intrinsic to him, unique, or at least, extremely rare. I still practice burn surgery at UTMB in Galveston. I still treat patients with devastating injuries. I still follow the protocols, perform the surgeries, do everything medical science has taught me to do. But I carry Michael Torres's case with me, locked in my private journal, documented only for myself. A reminder that the human body is capable of things we don't understand. That medicine doesn't have all the answers. That, sometimes, the best thing a doctor can do is protect their patient's humanity above their curiosity. I see Michael occasionally. He still works at the refinery. His family is thriving. The scars have faded to almost nothing. To anyone who sees him, he's just a normal man, husband, father. No one knows that his body performed a biological miracle. No one knows that he survived injuries that should have killed him, healed from wounds that should have left him scarred for life, regenerated tissue at speeds that violated every principle of cellular biology, except me, and Sarah, who kept the secret, and Maria, who just wanted her husband home. And I think that's how it should stay, because Michael Torres didn't ask to be extraordinary. He just asked to live. And sometimes, a doctor's greatest contribution isn't publishing groundbreaking research or advancing medical knowledge. Sometimes, it's simply protecting a patient's right to be ordinary. I keep the private documentation locked away. The photographs showing impossible healing. The notes documenting cellular regeneration that shouldn't exist. The evidence of a biological mystery that could change our understanding of human tissue repair. And I keep Michael's secret, because that's what a doctor does for their patient. Because knowledge without wisdom can be dangerous. Because some miracles are meant to be private. The human body is capable of extraordinary things. I've devoted my career to understanding its limits and pushing past them. But Michael Torres taught me that, sometimes, the limits we think are absolute are actually permeable. That biology might have mechanisms we haven't discovered. That the boundary between possible and impossible is less clear than our textbooks claim. And he taught me that protecting that mystery, preserving that patient's humanity, can be more important than solving it. I'm a burn surgeon. I've seen the worst that fire and heat can do to human tissue. I've watched people survive against impossible odds, and I've watched people die from injuries that seem survivable. But only once have I watched someone heal the way Michael Torres healed. Only once have I seen the human body perform what can only be described as a miracle of regeneration, and I've chosen to keep that miracle quiet, to let Michael live his normal life, to protect him from becoming what he never asked to be, a medical phenomenon, a research subject, a biological mystery to be solved. Maybe someday medical science will discover what made his healing possible. Maybe we'll understand the cellular mechanisms, the genetic factors, the biological processes that allowed his body to regenerate at impossible speeds. But until then, Michael Torres remains just another successful case in my career. A patient who survived extensive burns and returned to his normal life, just the way he wanted it, just the way it should be.